My name is Zaher Sahloul. I'm pulmonary and critical care specialist in Chicago, a practicing physician, and also the president of MedGlobal, which is a medical NGO based in the United States that provide healthcare in disaster regions. I'm Syrian American, and what's happening in Ukraine brings memory to me and the Syrian American community because of what happened in Syria. It's exactly the same at larger scale. The Russian invasion of Ukraine reminds me of the Russian brutality in Syria, where we had hospitals bombed, about 580 hospitals, medical professionals killed, 930 of them. Communities were put under siege, like in Ghouta and Homs and Aleppo. Chemical weapons were used more than 300 times. And right now we are seeing the impact of the Ukrainian crisis on civilians. Large displacement, 2.6 million people have become refugees in a short period of time. Communities in Kyiv and other places are put under siege. Hospitals, according to the WHO, more than 20 hospitals were bombed. And the impact on the healthcare workers is tremendous. I was privileged to travel to Ukraine with 9 humanitarians, doctors and nurses last week, 7 from the United States, 2 from the United Kingdom. We traveled through Poland to Lviv, which is in western Ukraine, and we have seen the impact of the war on the civilians of Lviv. It has about 200 to 300,000 in the civilians who were displaced from other cities. The atmosphere was very tense. Our health care worker colleagues were overwhelmed because of the number of injured people coming to their hospitals. We brought with us 167 pieces of luggage of medical supplies, and these are life-saving urgent medical supplies that came on time. We distributed them through the Ministry of Health to different hospitals on the front line and the cities under siege. We also listened and met with about 250 doctors from Ukraine through Zoom in the building of the Ministry of Health in Lviv, and they told us that they are worried about the impact of the crisis on the hospitals, targeting hospitals. How do they protect themselves? And they were very worried about the prospects of using chemical weapons. So we provided training on different types of chemical weapons that were used in Syria and how can we minimize the impact on civilians. We also committed ourselves to provide training on mass casualties, training, and also how to protect hospitals, how to improve your mental health, how to provide mental health first aid, and to continue support our colleagues by sending medical and surgical supplies. We witnessed the impact of the war in the city. The siren alarm sounded multiple times when we were there. We went to the bomb shelters. The atmosphere was very tense. It felt to me like it's World War III, and I'm worried that the situation will get worse before hopefully we will have a resolution for this war. We in MedGlobal and myself as Syrian American physician are standing in solidarity with our colleagues and the civilians of Ukraine. We will provide as much assistance as we would be able to, and we will be also the voice of the Ukrainian community in the United States. This is unjust war. Civilians will suffer, healthcare will suffer, and we need to stop it as early as possible.